A recent UNICEF report ranked New Zealand 34 out of 41 OECD countries for child well-being. This question has two parts. If elected, what immediate steps in the physical health area would you take to improve this situation? And given that we as a country now have the highest youth suicide rate in the developed world for adolescents aged 15 to 19, do you have a plan to address this problem? And if so, what is it? And if not, why not? Can I start with material? Start in the middle and work to the left, and then we'll come back this way.
What was the first one again, sorry, Bryan?
The first one is what immediate steps in the physical health area would you undertake to improve the situation? And then there's a suicide issue.
Sure. So there's a great deal that needs to be done. One of the things I think that we can do quickly is establish medical centres at schools. Now, this was our School Hubs program that we launched a few years ago, and it's designed around making sure there is access to nurses in particular, but doctors where necessary, on school grounds by families, so they can develop that long-term relationship with those families. The thing about that is that people don't have, in low-income areas, they don't have the resources to keep going to their doctor. They can't take time off to take their kids to the doctor, so their kids are getting sick. They themselves can't take time off, so they are getting sick. But school is a place where they go every day. It's a place that's close to where they live. They know that the people there, and so if we can establish good quality nurses and doctors at those school areas and those school hubs, then at least they get access to medical care that they can trust. It requires a slight shift in the system that we have around how to fund for this, but those families urgently need access. And they're not going to get access if we keep expecting them to just go to PHOs or to the main doctors. They just end up at emergency departments after all. That's where they end up going. And second, on youth suicide, one of the things that we need to be really conscious of is that SIFS does not know where its kids are. One of the big issues around homelessness, young people in homelessness, is that a great number of them are SIFS kids, and SIFS doesn't know where they are. They've escaped out of whatever SIFS care they are in. They're living on the streets because they prefer that, and they are at very serious risk of mental health issues, of abuse, and suicide. But there is no assessment of that because SIFS doesn't know that they're there. So they're not taking track, and they're not able to invest or engage in it. That is a particularly vulnerable group that I'm very concerned about at present, especially during the winter. And they are particularly susceptible to youth suicide as well.
Thanks, Material. Yeah, we'll go that way, and then we'll come back this way.
Yeah, immediate steps in terms of physical health is actually giving people the capacity to access primary care. So one of the big problems in New Zealand is that we've continued to focus at the other end of the health system. And we do want people to access and get access to operations and all the things they need, but we haven't given enough priority to primary care and preventative health. We've talked about some of the preventative stuff tonight with making houses warm and dry, but immediately making it easier to go. I actually think some of the model of GP care is a bit broken. I'm hesitant to say this with Nikki here, but one of the things we do need to do is actually allow young doctors the ability to come in and be GPs and not have to be small business owners, which is effectively what they become. Some DHBs directly employ their GPs. I think that model over time is actually going to facilitate a lot more access to primary care. Can I just put a plug in here for dental care and oral health, which is so neglected and needs a big funding injection. I announced our fiscal plan recently, and one of the reasons in it, we said we're going to put $8 billion more into health over 4 years, is so we can get the money to primary care. On mental health and on suicide, it's a massive issue, but I'll give you one policy that we've specifically announced. There are school health services for decile 1 to 3 schools. We want those school health services to be available to every school and have a particular focus around mental health and mental well-being. You'll ring the bell again before I can. There's so much more.
On healthcare, I'm just going to say, totally agree with Grant. There's absolutely no way that we can actually meet the demand in our health system through hospitals, doctors, and operations. We have to do much more to prevent people ending up in the hospital, and we have to start doing it now. So I totally endorse what Grant said there. Mental health is a massive pressing issue. But actually with mental health, it works much better when it's in the community. You know, as soon as you medicalise the issue of mental health, you actually make the problem worse. And that people get stuck inside the system. And when you look overseas, it works much better when you keep people out of the system, in their communities, involved in their communities. So we are going to increase, the Opportunities Party will increase the tax on alcohol. We'll also legalise cannabis, regulate it and tax it, and that will generate an awful lot of money for alcohol and drug rehab, and to invest in community-based mental health services, the likes of which you see in Europe. Leave it to the community to decide how best to fund those, how best to deliver those services.
Stuart, we're running out of time, so can I ask a local question of the local? Sorry, you're not a local candidate. Are you a local candidate? Yes, you are. And yes, Annika. Sorry. So you three, the local candidates. Yes, Stuart. So yeah. Okay. So for the three local candidates, the question is, in the latest National Youth Survey, almost 1 in 20 high school students in New Zealand reported attempting suicide in the last 12 months. In New Plymouth, you were recently shocked to hear of a 12-year-old girl taking her life. What do you think you can do in this community to deal with this health crisis? Let's start with Stuart.
Yeah, I happen to be a child and adolescent psychiatrist.
Okay, so we've favoured.
So
you have 1 minute.
Right. Okay. I noticed that in New Plymouth, the suicide rate first started shooting up in 2008 with the economic crisis, and what I noticed is working with parents who are under incredible financial stress, working very long hours, often at more than, both of them working long hours at 2 or more jobs, struggling to pay for housing, struggling to look after their kids, struggling, to get quality health care and education, struggling to pay GP fees. And I have absolutely no doubt that the massive increase in suicide in New Zealand relates to the immense financial pressure that we put families under, and is a major commitment of the Green Party to alleviate that stress. We would also restore the de facto cut in the healthcare budget of $2 to $4 billion, and we would address urgent, special attention to increasing mental health funding.
We need to increase regional funding, or funding in New Plymouth, for communities to get more involved in mental health and I think youth suicide, and it needs to come from the community. I think youth, people who are involved in the community, whether it's business owners or well-known people, need to get involved and work with the youth, just so they know they've got people to talk to and people to relate to. But we definitely need to increase funding there.
There you go. First and foremost, we need to focus on family and community, because these young people are connected at one level or another, and we need to ensure that we are connecting with them. We need to connect with them where they are, whether that's in schools or with youth groups, or with their peers. We also need to effectively resource and fund community agencies that work and focus in this area. We have an amazing community organisation here called The Retreat, and they struggle to get resourcing every year, or every month actually. We need to be funding, and we need to be throwing as much money as required to organisations and community groups like that to ensure that our young people are getting the support that they need.
Thanks very much, Paul.